fibroid, excessive bleeding, anemia, or mass in the abdomen. So fibroid in India, in reproductive age group women, is seen as high as 20 to 40%. And in perimenopausal age group, it is somewhere between 11 to 19%. What is this fibroid and why is it making so much of a noise? See, fibroid is a benign. When I mean benign, I mean to say it is a non-cancerous, I'm repeating, it's a non-cancerous growth in the uterine cavity. Now, it arises from something called the smooth muscles in the myometrium. This uterus fibroid, the symptoms of these uterine fibroid depends on where exactly it is located. If it is towards the cavity, if a small fibroid, say around 2 centimeter fibroid, also can create symptoms for us in the form of excessive bleeding, or it can be intermenstrual bleeding or spotting. And the second one will be something called intramural, which is inside the myometrium, in the middle part of the uterus. Third one is called the subserosal, which is towards the outside. And this subserosal can just continue to grow and have no symptoms. And the other one is called the pedunculated. Pedunculated is something which has an attachment to the uterus and the mass is going a little away from the uterus. Now, as I already mentioned, the symptoms depend on the size, the location of these fibroids. So what are the common symptoms that women face? Well, commonly what they face will be excessive bleeding. Now, this is one of the main reasons why patients decide to visit their gynecologist. So it can be excessive bleeding, it can be pain during menstruation, it can be intermenstrual. What I mean by intermenstrual is they can have bleeding or spotting between the cycles. They can also have pressure symptoms. If the mass is too big and putting pressure anteriorly, say on the bladder, so they can have increased frequency of maturation, they can have increased number of times that they have to use a restroom. If it is posteriorly, they may have a little bit of bowel disturbance. And a big one can also create a pressure and create a constant lower abdominal pain. So these are the common symptoms that we see for fibroid. Also, fibroid can have a role in infertility depending on its position, number of fibroids. So the common symptoms are these. When a woman experiences such symptoms, it becomes essential for her to visit her gynecologist so they can do a thorough examination. Now, if the mass is quite big, even a vaginal examination can give us a diagnosis of a fibroid, if it is towards the front or the back side of the uterus. To confirm it, most of the gynecologists will ask you for an ultrasound of the pelvis to know the number, again, the number, the position, the size of the fibroid. So a diagnosis can be made by performing an ultrasound. Now, there are various treatments for fibroid. And it always depends on what is the symptoms, what is the age of the patient, and what is the outcome that we are looking for. Now, if it is a young girl who's not completed her family, then definitely what we want to do is just remove the fibroid. So that is called a myomectomy. And with advanced medical sciences, a laparoscopic myomectomy can be performed. If the uterus is too big and she's postmenopausal, most of them will opt for removal of the uterus along with the fibroid. Now, I would like to mention one thing to you all, that when a woman stops to have her cycles, that is when she attains menopause, the chances of the fibroid increasing is unlikely. So most of them opt for waiting, and if the size or the mass is not producing much of the symptoms postmenopausally, there are very high chances for it to regress in size. The new and the advanced method, as I was telling you, there are many new advanced medications and methods which has come up, which prevents us from doing major surgeries like a hysterectomy. When I say hysterectomy, I mean removal of the uterus. So there is an entity which is called the uterine artery embolization, which is performed by the interventional radiologist. We also have something called the MRI-guided high-intensity focused ultrasound. So these are the advanced methods of managing a fibroid. Various medications are available which acts on the fibroid to shrink in size so it does not produce its symptoms per se. So I'd like to inform to our ladies that it is very essential for you to visit your gynecologist. I've always been a person who keeps telling you all, please make sure you do have your annual health checkup. So a simple vaginal examination also can give us a hint about this condition if it is present. But if you do have any of the symptoms which I have mentioned, it is very essential for you to talk to your gynecologist and plan your treatment ahead. Thank you.